So this is pretty normal mommy face, I guess. I brushed my hair, but I didn't put anything in it, so I look trashy. And I have a baby on my chest, so this is what we're gonna get. I haven't updated in a long time about my surgery and weight loss and everything like that, so I figured I'd do a quick one real quick while I have downtime, and my little man's dead asleep on me, snoring away. Well, he's actually not snoring right now. So, I'm a little bit over a year out. I think I am 14 months out. I could look up the thing, but I'm lazy. My lowest weight that I hit was 218. Excuse me, sorry. And then we found out we were pregnant. And it was a surprise. And it's an awesome surprise. As you can tell, he is a happy, healthy little guy. And I am so happy to have him in my arms. I was so scared that something bad was going to happen. So let's see. The highest I got weight-wise during my pregnancy was the day I gave birth. I was 245. Within a couple weeks, I was back down to 222. Right now, I'm bouncing between 222 and 224, depending on what time of day, whether I've gone to the restroom or not, how much water I've gotten in. And I am trying to breastfeed, so I'm not concentrating on losing weight right now because I have a very low supply, and so we're supplementing. I can get, this is his little bottle. This is actually breast milk right now. I can give him about maybe half and half, I think. Half breast milk versus half formula. He's on Similac sensitive because he gets a little gassy. I'm basically an exclusive pumper because he doesn't want to latch. One of my nipples is flat. The other one is good, but he doesn't want to latch. We had to supplement him in the hospital because he lost 8% of his body weight and he was at risk for jaundice. So they talked me into supplementing him until my milk came in. My milk didn't come in until about a week and a half. So yeah, it's a good thing we supplemented. He is almost 10 pounds or 10 pounds now. I'm not sure yet. We haven't gone back to WIC, and his doctor's appointment's not till the 21st, I think. So I won't know how much he's weighed, or he weighs now, or how much he's gained. So I carried him to 39 weeks. It was a planned induction because he was measuring big, and I did fail my gestational diabetes test, but my blood sugars were all actually low or normal. So I had it, but I think they said it was atypical or something. I don't remember. It was 100% diet controlled, and I can tell you this much. I didn't eat anything specific. I didn't make sure I was low carb because actually during my whole pregnancy, I had no choice but to eat carbs because I was so sick. During the first 4 months, I think it was. God, it was forever ago. During the first part of my pregnancy, I literally could not eat anything but potatoes. Like it was chips, French fries, crackers, baked potato, mashed potato. That was it. Anything else, I couldn't eat it. I could not eat protein. So I was trying to get protein in when I could. We figured out that if I ate some chicken or something and went straight to bed, I wouldn't throw it up usually. But that was give or take if I could actually eat it. I actually had a lot of food aversion. And the smell of food, the look of food. I couldn't cook for like 6 months. It was freaking annoying as hell because I would go in there to cook something, and whatever I made, if I could actually cook it, I couldn't eat it. So it was a fun little mind game thing. So they had me as high risk. I went up to Kingman 2 times a month towards the end, and I saw Dr. Thomas, who is amazing, and I freaking love him. And he measured him, and he said he was going to be about 8 pounds, and he was a couple ounces shy of 8 pounds. And I really think that the last week, I think it's a good thing they induced me because I think the last week he didn't grow. We didn't end up having to do another ultrasound or anything before we went in for the induction, but I think because I wasn't really eating towards the very end of my pregnancy, I was struggling really hard. I was so exhausted constantly that I basically slept most of the day. I had to stop going to work because I was getting sick. I couldn't stand up for long periods of time without getting dizzy. That had started during the beginning of my pregnancy, but towards the end I literally was like not functioning. and it was really annoying. I'm lucky that I have my coworkers that I do have. They really saved my freaking butt at work. They picked up the bags for me and everything, so I didn't have to worry too much about that. And work was really good about working with me and making it to where I could do it as little as possible. I still did my job, but I mean, like, picking up heavy stuff that I couldn't pick up, being able to sit down when I needed to, it was very helpful. So 39 weeks, planned induction. They brought me in to induce me. Hi, Papas. Look at this cute little fish. Look at that. I just want to kiss him. I kiss him all the time. How you doing, puppy? You're worse than the puppies. Yes, you are. So, they planned on inducing me. Hi. They planned on inducing me on the 10th, and then I gave birth to him a C-section on the 11th. They had me come in on the 10th at midnight, or no, it was 7 o'clock. They told me to have a big meal before then. I was allowed to eat until midnight, so about 15 minutes to midnight I ate. And then they had placed this, what are you doing? They placed something called like Cervidil or something, I can't remember what it's called, inside. They said up and behind my cervix. I didn't know you could get behind your cervix, and it is a cardboard thing, and it hurts really bad, and it did cause me to have contractions. And you should know, I was not ready to go into labor at all. I was showing no signs. I was having a butt ton of pelvic cramping and pelvic pain and pressure and stuff, but he was still up high. My cervix never dropped, never softened, anything. So this was just, my doctors didn't want me going past 39 weeks, and they didn't think it was safe. My blood pressure was also starting to go all over the place, so it wasn't safe. So they didn't want me to go past. So they're like, I told them I don't want a C-section. I really don't. I'd rather try to be induced if we have to. I don't really want to be induced either, but since my options of him being here safe and alive are this, then we're going to do what we have to do. And he said, I don't think the induction is going to work, but I'm willing to try it for you. So he had me go in, take the Cervidil or Cervidex or whatever the hell it is. And he said, if I showed that my body was gonna go into labor, like I softened and my cervix opened and lowered or anything like that, then they'd give me Pitocin and stuff, and they'd go on with the induction. It has to be in for 12 hours. So they did that, and they checked me in the morning, and there was nothing, no change whatsoever. I was still high and tight and hard and not ready. So they said, this is probably going to mean a C-section. And I'm like, all right, it's a failed induction. My body just wouldn't respond. With the PCOS, I usually don't respond to stuff like I'm supposed to anyway. And I had already told everyone, my fear is I'm not going to respond to the hormones that they're going to give me to get my body to work anyway. So probably going to have a C-section. I still have an apron. I don't want to get an infection. That was my biggest fear with the C-section, was getting an infection. And I didn't get one. So my doctor comes in, and I end up in tears, and I'm just like, all right, let's do this. I didn't want a C-section, but you know what? I want him out. I want him safe. That's all I care about. I should point out, though, that my contractions that I felt the whole time the Cervidil was in, I was uncomfortable. I didn't get to sleep, nothing like that. So I kind of went through hell, but I didn't go through the whole pushing labor part or that part. But my contractions were in my lower back and my bad hip, which is my right hip. And there was nothing I could do to get comfortable. And they were constant. It was just like, okay, it stopped. Fuck, it's here again. And I just remember going, if this is what labor's going to feel like, I'm not going to make it. I'm going to have to get an epidural. And I didn't want one because I don't like needles. And I really didn't want a needle in my spine. But I told everybody, epidural, I don't want one, but if I can't handle the pain, obviously I'm going to do it. So my whole birthing experience, my whole pregnancy experience was nothing that I wanted. It wasn't like the planned perfect pregnancy. It wasn't anything like that. And then my birth experience was stressful and not what I wanted either. And then breastfeeding hasn't gone well. So I'm at a high risk for having postpartum depression, but I don't think I've got it. I mean, I'm fine. I'm functioning. I'm taking care of my son, and I'm freaking happy as hell, so I highly doubt I have it. But, I'm on watch for that. But I've been pre-op 4 weeks. He turns a month on tomorrow. He's a month tomorrow. So, I highly doubt I've got it. I'm pretty sure I'm good. But some people say it comes on later, so they're just going to keep an eye on me for that. Anyway, so I'm rambling. But they decided to, we're going to do a C-section. And I tell my doctor, thank you for letting me try. And he's like, no problem. He's like, I was hoping it would work, but I just didn't think it would because of how high and tight you were. Now, there's going to be a lot of people bashing, you should let your body go naturally, blah, blah, blah. Just because you're overweight doesn't mean anything, blah, blah, blah. My health has always been stupid. My body has always been stupid. I worried the whole pregnancy that he was just going to stop growing. I worried the whole pregnancy his heart was just going to stop. So my doctor taking him out at 39 weeks was fine with me. Plus, I was done. I was so done. I was having those pains in my hip before they gave me the Cervidil, or whatever the hell that shit was called. Before they gave me that medication, I'd been having those pains in my hip all day. And they would come, and in my lower back spasming. I was just over the whole thing. And I understand, and I wish I could have kept going, but my body wasn't handling it well. So, and he is perfectly healthy. No jaundice, no anything. So they took me in. That whole C-section thing is another story for another time. They had to knock me out because I was bleeding. The best part ever, and we didn't get to get a picture of it, so I'll never have a picture of it. And we didn't get to get a video of it, but they brought him over to see me, and I was laying there because they have your arms strapped down, and they brought him close enough, and the only thing I could do was give him little Eskimo kisses on his nose and tell him how beautiful he was before they took him away. And my husband went with him, and my husband didn't want to leave me. He was like, babe, are you sure? And I'm like, go with our son. I want him with you. Like, I didn't want him with some stranger. I wanted him with one of us. So I was like, no, go. And then they knocked me out. They actually knocked me out twice. I woke up, and I said, thank you for knocking me out, because I was feeling really bad. And then they knocked me out again, and then I woke up in recovery. So, yeah, but this little guy took a lot to get here. He's going to be a month. I still worry about him constantly because, that's what mothers do. But he's amazing. His name is Riot. And I freaking love him so much. Being a mother is better than I thought it would be. It's stressful, and I'm tired, and my sinuses are acting up really bad because of the crazy wind and the whole thing. Only thing I can think right now is don't be getting sick because you'll get him sick. But so far I've been like this for like a week now. The wind started up really bad last week, and nothing, just taking my allergy medicine, and I'm doing good. So unfortunately I'm not losing more weight right now, but I don't really care. I can lose weight whenever. I'm not gaining. I'm not, going back to 315 pounds. And the whole reason I had the surgery anyway was to get this. So I was successful, and I hope everyone else can be. Anyway, love you guys. I just wanted to do a little update. He's going to have a diaper change soon, and I'm going to go back to cuddling with my little love, my beautiful baby boy. Love you guys. Bye.